Hello there. Why is my dog still drinking and urinating a lot? This is video 4 in a 4-video series that discusses polyuria, polydipsia, or drinking a lot and peeing a lot. And now we have only left to rule out both acute and chronic rhinophalia and the urinary incontinence. Let's look at acute rhinophalia. A dog's kidneys will lose their filtration and excretion abilities if the dog ingests a very toxic substance that suddenly destroys the nephrons and glomeruli, or the functional units of the kidneys. Contaminated food is a very common source of toxic substances. What are the clinical signs of acute kidney failure? You have a sudden loss of appetite, as vomiting, abdominal pain, diarrhea, dehydration, depression, polyuria, polydipsia. Comes all of a sudden. Comparing a dog with diabetes and acute rhinophalia is no brainer going by the above clinical signs, symptoms, or signs. Let's look at chronic rhinophalia. The difference between acute and the chronic rhinophalia is the slow development of the clinical signs. Chronic rhinophalia is a disease of old dogs that have been fed poor quality food for years. What are the clinical signs of chronic rhinophalia? You have occasional intermittent loss of appetite. You have occasional vomiting. You have diarrhea, vomiting and diarrhea. You have chronic dehydration. You have a depressed and very shaggy dog. You have polyuria and polydipsia. When a polydipsic and polyuric dog is presented to me, the routine is to order a complete blood panel immediately after examination. While the blood panel results will differentiate and confirm the diagnosis, the history and clinical signs are adequate to formulate a treatment plan. And now we are only left with one probable cause of polyuria, polydipsia in your dog. And that is urinary incontinence. Urinary incontinence is an involuntary urination due to loss of control of the urinary bladder and the urethral muscles. It is more common in dogs and extremely rare in cats. You only worry about urinary incontinence if you rule out all the other causes of polyuria, polydipsia by clinical signs and diagnostics. I hope now you'll be able to observe your dog's behavior and figure out the cause of polyuria, polydipsia, even before visiting your veterinarian for treatment. This is the end of the video. If this video was helpful, share it, comment, or ask a question below. Thank you for watching and see you in the next video.